While women make up roughly 3/4 of the U.S. healthcare workforce, they are still vastly underrepresented in leadership positions.
Our team at Couric Media recently sat down with 4 extraordinary women leaders in healthcare: Maya Martinez-Davis, Candice Robinson, Dr. Darilyn Moyer, and Dr. Kelly Moore. They discussed the important contributions women make in the healthcare system, the critical role of workplace diversity in shaping a system that can serve everyone, and how GSK is investing in initiatives that support gender equality and leadership development. Whether you're just starting out in your career or leading an organization, this is a critically important conversation for everyone.
So I'm heartened by the fact that we're seeing more and more women in the healthcare career pathways. Now over half of the U.S. medical students currently enrolled are women. That's very, very heartening. But the unfortunate thing is they're sort of segregating into the already women-friendly areas, that like pediatrics, internal medicine, psychiatry, family medicine, et cetera. So I think we need to continue to really focus on where women and other folks who bring diversity to the table are missing from. And I think we just need to continue to support women who are put into leadership positions, because there is a predilection to put women into leadership positions when organizations are in a time of crisis. So it's almost like sometimes they get thrust into leadership onto a glass cliff at times. So I think we need to understand and support each other, understand the unique needs of our diverse groups of leaders, and support them.
I think as we see a lot more women leading in healthcare, that's valuable because we have a collaborative problem-solving approach. We have that desire to raise the health of the community and the family all together. But we need more women leaders in the groups that are going to be essential to helping healthcare leaders effect the changes we need to. And that means women in political leadership, women in industry leadership across pharma, so that then we can come together collaboratively across disciplines to solve these really important fundamental problems, especially those related to health equity and improved health for all.
It's really important that we keep a focus on it, because what I've realized is when you don't, you'll see that balance sometimes shifting. So I think it still has to be something that we constantly are looking at. I think that there are areas, and I would say probably more in the biotech space, where we're starting to see women in leadership roles. I think there's still a big opportunity when it comes to board positions. And it's something that there's a lot of work being done in that space. So I hope, if you ask me in 2 years, that that's an area that we've evolved in.
I agree with kind of everything everyone has said here. You know, we've made strides, and it's been phenomenal to see, you know, women in leadership roles and step up into leadership roles and be embraced in leadership roles as well. And I know we aren't there yet. You know, I don't fully know where there is, but I get the sense that we're not there yet, because I do think that, you know, we'll continue to see women lead in healthcare, lead in medicine, lead in different industries. And we want to see women leadership and their leaderships being embraced. You know, this embracing of empathetic leadership, this embracing of team leadership, of servant leadership, and leadership styles that are sometimes common in women, also being embraced and not discounted, because they're very powerful in their own right.
I think diversity is really important in all aspects of our world, but particularly in healthcare, where details matter. Connecting with people really matters, so that you can get a good history, can really understand what's going on with them. And I think, you know, there is a really mounting body of evidence that the more diversity we bring to the realm, and that means all types of diversity, and to the leadership tables, the better outcomes that we have, the better, not just the financial outcomes, but the outcomes around satisfaction, engagement, and the very human outcomes. Who is caring for our patients truly matters. And it's not us versus them. It is what can we learn from all of us that we can bring to our practice so that we can improve care for our patients.
One of the things that I learned early on, that's one of my absolute rules, is never assume. When you're working up an outbreak investigation, working up a patient, never assume. And when we bring different perspectives to the table to solve a problem, we can help ensure that we collectively are not making assumptions about the populations that we're serving, because I don't understand every other person's point of view. And that's fine. I don't need to, but I need to have someone on my team who can speak to that community and help me inform interventions that are not simply based on my assumptions about another person's needs.
Yeah, I mean, I think, Kelly, that's exactly how I see it. I think that I want to have a leadership team around me that can have different perspectives. And also, when you're trying to tackle issues like health equity that we are, right, across the United States, if we don't have people with those diverse experiences to help us put together plans to better reach those communities, right, you're never going to be able to do that.
Yeah, I think it's really getting those insights from, different people who have different perspectives, who come from different places. And I think as we try to, impact the health of populations at large, the populations are made up of so many different people. There are so many different backgrounds. There are so many different traits and ideas. And if you don't have that perspective and that insight, that makes it harder to kind of tailor what you do to the community that you're serving.
I think it's really interesting because if I think of my career, I've learned so much from people that were great leaders, and I've learned just as much about people that were not very good leaders. Because when you live that, you're like, I'll never do that when I'm in that role. And, I spend a lot of time with the people that join our organization, talking about just career choices, options. What are the possibilities of what they can and can't do, how to put it all in perspective. And I think that if you care about people's development, there's nothing more gratifying as a leader than seeing the people evolve in their roles, becoming stronger leaders, becoming better persons, becoming caring leaders for their teams, empowering leaders, trusting. It's really one of the things that you get so much satisfaction.
One of the things I always tell my mentees is look for people who are interested in who you are and where you're trying to go, not just trying to create a carbon copy of themselves. And I've been so fortunate to have those kinds of mentors along the way from my earliest career days onward, because my path wasn't typical for someone in medicine. I didn't really intend to practice clinical medicine. I never did beyond my pediatric internship. And yet I had mentors who saw me and saw my gifts and helped me cultivate those to bring me to where I am today. And I'm ever so grateful.
Yeah, and I would say, I kind of feel like kind of in the middle of the career. So I am starting to have people come to me for mentorship, but I'm also, continuing to seek out mentorship for myself. I've never really felt like, okay, I've learned everything, done. I think it's a process of never stop learning, a process of continuing to learn from others, continuing to forge your path, continuing to see where you want to go, and finding people that will help you navigate your career.
One other thing that we didn't touch on about mentorship is really the importance of having mentors outside of the healthcare profession too, not just sort of within your own line of work. I have learned so much from women professionals outside of healthcare as they look at my skills and what I do and give me a fresh perspective on what they see in me that it's hard to see from within our profession because we're kind of accustomed to the skills that are expected within our profession. And so I always encourage people, look for women who are leaders in completely different paths and come together and support one another to help each other grow.
one of the things that we invest in is making sure that you have a pipeline of women that you're investing in their development and they're going to be ready for those next roles. And because if not, you're going to place people in the wrong positions for the wrong reasons. And I think that, making sure that when I look at my succession plans, you have 3, 4 diverse candidates, right, with different experiences that when the time comes when I move my role are ready for my job. And depending on what the business need is, that would be the pool, but that pool has that gender diversity is how you get there. We have to also make sure that we're set up in a way to be successful in these roles so that we've had the right experiences that make us the strongest leaders when these roles are open. And I think that's what we're focusing on.
And I've seen that firsthand, being newer to GSK, coming in, and I've seen the internal structure that's already built around development, the internal structure that's already built around women's leadership initiatives and how active different internal groups are to really ensure that development of future leaders within the company. And I think the more that, different areas do this, the more we'll have women and different leaders, a diverse group of leaders trained for those next steps in their career.